Hey everybody. So in this video, I want to show you one of my favorite exercises that I use not only for amazing core training, but for hip mobility. Hip mobility is one of the areas that I look at a lot when dealing with core and pelvic floor issues, right? Because as I've talked about 1,000 places, and you can just find them on YouTube or on my Restore Your Core group files, your hip mobility and your hip function is very much tied into your pelvic floor and up into your core. So try this sequence, see how it goes for you. It's challenging for everybody. It's also challenging for me. So don't freak out if you find that it's really challenging for you. Let's adjust the camera here. I'm going to show this to you at a few angles. Just try not to chop off my head. I'll show it to you at a few angles just so you can absolutely see what I'm doing. So I'm going to start in this angle, so don't freak out. I'm going to change angles in a minute. So when you begin, you want to just stack yourself up on all fours. You want to see that your knees are right underneath your hips, that your hands are under your shoulders. You also want to make sure that you're not collapsing like this. So if you start with your upper body, you can push your hands gently into the floor. You can raise your chest gently away from the floor. Be sure that your pelvis doesn't tuck under like this, and be sure that you're not overly untucking your pelvis like that. Okay, so neutral is another word for all of that. Okay, so from here, the first thing you're going to do is get your hips warmed up by internally rotating them and back in. So you keep your knees exactly where they are. I'm going to come off my hands and knees just so you can see my legs. But you keep your knees exactly where they are and you slide your feet out. You want to try not to use momentum for this. Okay, just sliding your legs out and back in. You can lift your legs an inch off the floor. You can do it again. You can slightly flex your feet. Don't overly flex them because then you recruit a whole host of other muscles. And then continue. And you can bring your feet together or back to where they started. And you're just playing around with internally rotating them and back in. I'm going to crouch so you guys can see me. So the thing about this is that a lot of us lack internal rotation. We lack the ability to bring our legs into that position. So before we start loading up our body in this next exercise, which is more challenging, we just want to check in and see where's our internal rotation. Okay, the next exercise. So you do that, let's say, 10. It's not that hard to do. It's just more interesting. And then you can hold the internal rotation for a minute and see. The next exercise we're going to do, find yourself on your hands and knees. This is my hotel room series. And then you're going to lift. Let's start with the left leg. You're going to lift the left leg off the floor. Here's where core training comes in. When I lift my left leg off the floor, my whole body wants to shift right. And not only that, I can see in my right leg that it's diagonal. It's not straight up and down. So as you lift your left leg off the floor, check into your right leg. She should still be straight up and down. Then I'm going to bring my left knee in a little bit closer to my chest, but make sure that my spine doesn't tuck. And that's also a core workout because what's preventing your spine from tucking is stability. In a lot of the work I do in Restore Your Core is learning to be able to move different parts of your body without your whole body coming along for the ride. So an integrated body is what we're going for, right? So you bring your knee slightly in, the rest of your spine stays the way it was. So your knee may not come close, and that's fine. You then begin to open it out to the side. That's external hip rotation. I'm thinking I should go this way a little bit for you guys. Okay? Now, when you do that, you don't want your body to creep to the right. You don't want your left hip to open up too. However, it has to be noted that the left hip will move a little bit. So there's no such thing as doing this next exercise without your hips moving a little bit. Your hips are attached via a joint to your leg bone. So when your legs move, there will be some movement from your hip. The key is where are you initiating your movement from. If in order to move your leg, you have to move your hip, that's not what we're after. But if your hip moves and you get a referral into the hip, leg moves, and you get a referral up into the pelvis, that's okay. Okay, so just, but you want to minimize, so it shouldn't be this enormous movement. So then your hip goes out. So we were here, then the hip comes out. That's external rotation. Now we're going to begin to internally rotate it, bringing it back behind us hello glutes, your core is still stabilizing you so that you're not leaning off to the right, and then bringing the leg back in. And that's the movement. I know my head was chopped off a little bit there. It's hard in these hotel rooms to get a good angle. So if I were to do it so you do it, I'm going to tell you like about 7 times on one side. It's hard, you'll be sweating. And then you go the other way. So you're going to bring the leg back behind you. And the leg here, you can slightly internally rotate it by bringing the heel, my left heel more to the left. So just a little bit. So you can see my foot off the side of the screen. And then, so I'm going this way, and then I'm going to begin to open up the hip into external rotation. Don't lean off to the right. Bring it in and back in. And the whole time, you shouldn't be having this with your spine. So it's really good to videotape yourself. Please don't send me 100 videos of you doing it. I cannot possibly watch that, but videotape yourself and watch yourself doing it and see what your pattern is, right? So I videotape myself doing it and it helps me get more clear in my movement. So I'm going to do it one more time without talking just so you can see the movement. I think I'm going to elevate my screen just a little bit. Might help. I'm going to face this way. I'm not going to talk. So first direction. Second direction. What I do when I do these is I do about 7 one direction and then 7 the next, and then I finish it with some leg raises. Okay, so classic leg raises. You might not be able to see my whole leg, you won't, but my leg is straight back behind me, believe me there. I'm going to cut my head off to spite my nose and just lifting and lowering. And again here, don't lean off to the right, stay centered, and yeah, there's no way you're going to get to see my whole body, so who cares? And you're just slowly lifting the leg up, very slowly, and then lowering it, staying centered. There's no way, see, I'm even sweating now, kind of out of breath. So I just finished my workout before I made this, so got me warmed up. So there's no way that you're not going to feel your core if you're not letting your body shift from side to side to side. You will feel differences in one side to the next. It's fine. This is an amazing way, again, to train your core and to get that hip mobility back. If it's really important to have your leg be able to move in a variety of different directions. If your leg is stuck to your pelvis and every time you move your leg around, your pelvis comes with it, there's no differentiation. And as a result, there can't be this core integrity and core, this kind of, integrity and float into the system. So work on those things, try them, practice them, and of course, let me know how it goes. Bye.